Hello, my name is Dr. Brian Trautman of Mount Pleasant Chiropractic Rehab, and I'd like to show you an exercise today. You ever have any kind of knee conditions? You may want to get it checked out. You may have a meniscus problem. The meniscus is a joint right in through here, right between the femur, which is this big bone here, and the tibia right here. And a lot of times, if you don't have anything like ligament damage, let's say like an ACL problem or MCL problem or collateral ligament problems, a lot of times what I find a lot of my patients is that they have a meniscus problem. The meniscus, it's a really tough one to work with. More consistent work with it helps considerably because it's a very avascular joint, meaning it doesn't have too much circulation going to it, so it tends to heal very slowly. So this right here is Lisa, and Lisa is a runner, and once in a while she'll have some knee issues, and I have ruled out that it is a meniscus problem. So we're going to show an exercise called the meniscus pump. So what we're going to do is first find where the meniscus is. Right through here, there's two little divots in the bottom part of the kneecap. Okay, they may sometimes called the eyes of the knees. If you move back and forth on that surface right there, good. Now I have that paper down there so it can slip and slide pretty easily. You can feel the joint movement. This bone is stationary. This one's moving down and back. So I'm going to contact the meniscus, which is a little spongy area where there may be a little bit of discomfort. Okay? Put some pressure there and go back and forth on the paper. You moderate how effective the exercise is by how much pressure you push at the meniscus, which right now I'm at the medial meniscus, and also how much you're pushing and pulling with your foot. The next thing you're going to do is I'm going to have you rotate your foot to the left, good, and go back and forth, perfect. I'm just going to have you just kind of go back and forth this way though. Now if it's a medial meniscus issue, most times that one tends to be a little more discomforting. And then I'm going to have you rotate your foot to the opposite side and back and forth again, going straight. Perfect. So I have the contact with Lisa here. She can also do this herself. So once again, you find those little notches here, there's a little soft divot in between those two bones. At least I'm going to have you find that. Good. Just like this. You're going to hold with both thumbs and you're going to go back and forth yourself. Perfect. Say about 10 times front to back this way, 10 times this way, and 10 times the other way. You can do it the other way too, it's fine. Perfect. Okay, that's the exercise. You could also do it with the lateral meniscus, which is on the other side of the kneecap right about here. Very, very good exercise, very, very effective. I find about 19 out of 20 patients that I give this exercise to and I work with them, they all do really well with it. Once in a while, there may be a little more discomfort afterwards. Then I like to check it out a little further. Sometimes it may have possibly, there may be some other issues involved. But all around, this is a very good, safe exercise. Can be done more of a preventive type of exercise and also can do an awful lot to help take care of a lot of knee pain. Also, what I tend to find with a lot of patients is that a lot of times with having a meniscus issue, they tend to have a lower back issue too, okay? With having a misalignment within the pelvis, which is this right here, the pelvis is that foundation for your spine and body, kind of like the foundation of a house. What I find is sometimes the ligaments can sprain and strain, causing the pelvis to shift out of place. And just like how the pelvis shifted that way, just like a misalignment in your car puts unequal wear and tear in your tires, it'll do the same thing with your legs. And your knees are your secondary shock absorbers. So it helps quite a bit with correction of the pelvis, especially that sacrum, with helping the patient get better. So try these knee exercises. If it does persist, see me, see a chiropractor. Okay? It could be located at South Green Bay Road and Kinsey Avenue, right there in Racine. You could look at us on a website, which is racinechiropractic.com, or give us a call at 262-633-6325. Thank you. Hopefully this exercise is very useful to you. It helps me out and helps my patients out considerably. Thank you, and have a great day.